Here's the
Well,
governor.
Good afternoon, and thanks again for being here and for watching and listening from home. Today I want to talk to you about alternative care sites as we prepare for our surge capacity, personal protective equipment, also referred to as PPE, and our census. I want to start today with our fundamental message: stay home. On Monday, I ordered Virginians to do just that, to stay home, except for necessary trips out for supplies, medical reasons, work, or to care for another person or animal. I know this is difficult, and many sacrifices are being made, but the sooner we can put this health crisis behind us, the sooner our lives will return to normal, and the sooner our economy will rebound. That executive order lasts until June the 10th, as does our emergency declaration, unless the situation changes enough for me to lift it early, and I hope that it does. That's longer than most other states. I want Virginians to be realistic in their expectations. You need to know the truth, no sugarcoating. I know this is hard. People are isolated, you're worried, and many of you are out of work. My strategy has always been to plan for the worst and to hope for the best. Again, I know that this is very difficult for everyone, and I want Virginians to prepare themselves for the long haul. We are talking months, not weeks. While we continue to examine the available models about when Virginia's cases will surge, we currently expect that will be sometime between late April and late May. I am already thinking and planning on how we can land this plane on the backside of the curve. But for now, we are at the beginning of this virus, and that is why it is so important for Virginians to stay at home. If we can all stay home, we don't give the virus the chance to infect the next person. We slow it down. To expand on this just a bit, the virus can't live by itself. It needs people like you and me, referred to as hosts, for it to survive and to spread. So what we are talking about is making it as difficult as possible for the virus to latch on to a host. The CDC called social distancing a powerful weapon, so let's use it. We've gotten a lot of questions about exactly what this stay-at-home order means. It means stay at home. Don't go out if you don't need to. Don't go out because you're bored. Go out when you need to, and not when you want to. The more people that stay home, the fewer people that will get sick. But make no mistake, we are preparing for the people who will get sick. We've been working with the United States Army Corps of Engineers on potential sites for alternative hospital beds. They've now evaluated 41 sites across our Commonwealth. We've narrowed that down to the ExxonMobil facility in Fairfax, which is literally next door to Inova Fairfax Hospital, the Hampton Convention Center, which is in close proximity to Centera and Riverside hospitals and is central to Hampton Roads, and a site in the Richmond area. We'll have a decision and more information on that in Friday's briefing. Also today, we have received a third shipment of PPE from the national stockpile. That includes face shields, gowns, and masks, but we need more. We continue to work all available options for getting more personal protective equipment for our frontline medical personnel. I have also heard questions about upcoming elections. During the duration of this stay-at-home order, Virginia is scheduled to hold 2 elections, local elections in May and congressional primaries in June. I consider elections to be a fundamental democratic event and voting to be an essential right. We are continuing to work through the best options for how to hold these elections in this time of social distancing and public health concerns. In the meantime, I encourage Virginians to use absentee voting to vote by mail. It is easy to request a ballot by mail and return it by mail. For those who live alone, you can ask a neighbor to witness you signing it at a safe distance. Elections are vitally important, and we will ensure that they are held. Now I'll turn it over to our Virginia Health Commissioner, Dr. Norm Oliver, for an update on the numbers and also on how our modeling efforts are going. Dr. Oliver, thank you.
Thank you, Governor.
Yes, sir.
Good afternoon. The numbers on the COVID-19 cases, as you know, are updated each morning at 9 a.m. on our VDH website. Today, we have a total number of cases of 1,484. That represents 234 new cases since we reported on this yesterday. The total deaths from COVID-19 are 34, which is 7 more than the prior 24-hour period. We continue to have a cluster of a high number of cases in Northern Virginia, in Arlington, Fairfax, Loudoun counties, as well as Prince William County, and in Central Virginia here in Henrico and Chesterfield, as well as the peninsula, a number of cities and counties in that area. There are 305 COVID-19 patients who are currently hospitalized across the Commonwealth. 145 of them are in ICU beds, and 108 are in ventilator support. The governor mentioned that we are working on modeling. There are a number of models in existence, as you all are aware. More than a month ago, Imperial College in London published a model. There's models from the University of Washington, from University of Pennsylvania. Here in the Commonwealth, the University of Virginia, at the Data Science Institute there, researchers have built a model that's being used by the Defense Threat Reduction Agency. They have agreed to work with us and have been working with us over the last couple of weeks. And we will, in just a few days, be able, I think, to present a model that has Virginia-specific data, which will therefore be a much more accurate projection on what we can expect here in the Commonwealth. And we'll report on that when that becomes fully operational. Thank you.
Appreciate it. April the 1st is Census Day in the United States. Although census takers won't be going door to door because of social distancing, it remains vitally important that Virginians fill out the census forms they've received through the mail. You can do that by mail or online. Getting an accurate count of everyone living in Virginia will ensure that we get our full share of federal funding for a variety of programs. That will be even more critical as we work to recover from the impacts of this pandemic. I'd like to ask our Deputy Secretary of the Commonwealth, Tracy DeShazier, to speak briefly about the census. Tracy, thank you.
Thank you, Governor, for allowing me to be here on Census Day and to take a moment to remind everyone how important it is for every person living in Virginia to be counted in the 2020 census. The census is a population count, and it's been conducted every 10 years since 1790. Census data is used to determine how federal funding is distributed to states and how many seats each state will have in Congress. Additionally, it helps communities shape public safety planning and more. The results of the census will impact each of our lives for the next 10 years, and so I'm here to ask each of you to take just 10 minutes today to fill out your census. Over the next few weeks, each household across Virginia received a letter with instructions to fill out the census. For the first time, you can now complete the census online by visiting 2020census.gov, by phone or by mail. Everyone, including children ages 0 to 5, undocumented residents, everyone should be included and complete their census. By law, all census responses are completely confidential and your information cannot be shared. It can't be shared with law enforcement or anyone else. Additionally, the census will not ask you for your Social Security number, your bank account information, political affiliation, or citizenship status. Your responses are protected by law, and it'll only be used for statistical purposes. Again, census data is used to determine how more than $675 billion in federal funding is allocated. This includes programs such as Medicaid and Medicare Part B, SNAP, WIC, housing vouchers, school lunches and breakfasts, community health centers, Pell Grants, and federal student loans. We can't afford to have Virginians not be counted and lose out on critical funding to support our communities. Thank you to the efforts by the governor and the Virginia Complete Count Commission, as well as Virginians who have already responded to their census. And currently, we're an 8th in the nation for self-response so far, with more than 40% of households in Virginia having already responded. So please visit 2020census.gov or call 844-320-2020 and take 10 minutes today to fill out your census. Also, important, the phone number that you can also text us to ask questions is 804-203-0393. Thank you.
I want to reiterate that I know all of this is hard on everyone, and I thank all of you for the way you're handling this situation. Today is the first of the month, which means rent or mortgage payments are due. And for many Virginians, that comes just after they are being laid off or furloughed due to this pandemic. I encourage all of those Virginians to apply for unemployment. That will at least provide some help. For those who have federal mortgage loans through the Virginia Housing Department Authority, we're deferring loan payments for up to 3 months if people need it. We're also suspending evictions for anyone with public housing vouchers. On March the 16th, I asked the Virginia Supreme Court to declare a statewide judicial emergency, which they did. By suspending non-emergency court proceedings, we also suspended eviction proceedings through April the 26th. April also brings important religious holidays. This weekend, Christians will celebrate Palm Sunday. Next week is Good Friday, and then Easter Sunday. For the Jewish faith, Passover begins next week. For Muslims, Ramadan starts later this month. Buddhists and Hindus have religious holidays coming up as well. These are important times for faith communities, and normally they would be celebrated together. I am a man of faith. In times like these, many of us draw strength from our church and our faith. During these times, our faith is more important than ever. But for the safety of everyone, we need to find other ways to celebrate our faith right now. Online sermons are a good way to help sustain that connection. Drive-in services where everyone remains in their own vehicles are another option. On Friday, we'll have further guidelines and suggestions from our faith leaders. Yes, we have some people who are not following social distancing rules, and to me that is frustrating. But we have so many more Virginians who are, and to all of you out there that are, I say thank you. We have frontline workers, from our medical staff to our grocery workers, to the folks in our school divisions delivering food to students who are working every day to help other people. We have people sewing masks, signing up for our volunteer medical corps, looking for ways to help out. We had people in Northern Virginia who raised money to buy laptops for students, and they donated those with hotspots and prepaid cards to get internet access to students all the way on the other side of the Commonwealth in Bristol. I can't tell you enough, Virginia, how much we appreciate everyone who is stepping up. If all you're doing is staying home, that in of itself is a contribution, and I thank you. We are all in this together. Thank you, and we'll be happy to take your questions.